ಮತ್ತೆ ಡಿಯರ್ ಡಾಕ್ಟರ್ ಕಾರ್ಯಕ್ರಮ ಮುಂದುವರಿತಾ ಇದೆ. ಈ ಮಾಸ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ನ ಕುರಿತಾಗಿ ಅರಿವು ಮೂಡಿಸುವಂತಹ ಮಾಸ ಅಂತ ಹೇಳಲಾಗ್ತಾ ಇರುವಂತದ್ದು. ಹಾಗಾಗಿ ಕೇವಲ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ ಮಾತ್ರ ಅಲ್ಲ, ಎಲ್ಲಾ ತರಹದ ಕ್ಯಾನ್ಸರ್ನ ಕುರಿತಾಗಿ ನಾವು ಇವತ್ತಿನ ಡಿಯರ್ ಡಾಕ್ಟರ್ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಮಾತನಾಡ್ತಾ ಇದ್ದೀವಿ. ಎಸ್ ಡಾಕ್ಟರ್, ತಾವು ಹೇಳ್ತಾ ಇದ್ರಿ ವೇರಿಯಸ್ ವೇಸ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟಿಂಗ್ ಅನ್ನುವಂಥದ್ದು. ಈಗ ಕಿಮೋಥೆರಪಿ ಬಗ್ಗೆ ಮಾತಾಡಿದ್ವಿ, ತಾವು ಹೇಳಿದ್ರಿ ಇಮ್ಯುನೋಥೆರಪಿ ಬಗ್ಗೆ. ಸೊ ಇದು ಅಂದ್ರೆ ಏನು, ಯಾರನ್ನ ಈ ಒಂದು ಥೆರಪಿಯಿಂದ ಟ್ರೀಟ್ ಮಾಡಲಾಗುತ್ತೆ?
Immunotherapy, I just described. The immunotherapy is a therapy which has become very, talked about from 2016. There were small waves of immunotherapy from the past 20-30 years, but from 2016 it has been approved for most of the cancer type, especially breast cancer, because it's breast cancer month. So immunotherapy is basically a way of treating cancer in which you give either some drugs or give certain type of vaccines to modify your own immunity or your own host responses towards cancer. So we give some type of medicine so that the body can itself fight against the cancer which is inside the body. So immunotherapy is of various type. As I said, one is drugs, one are medicines which are given, which act on certain type of cells known as T lymphocytes, and these lymphocytes are modified in certain way so that they kill the cancer cell which is growing inside the body. But this is commonly used in lung cancer nowadays, and it is very commonly used in breast cancer. But most of the time, before giving this type of therapies, you have to check whether a patient will respond to this therapy or not. An interesting modality of treating, an interesting subtype of immunotherapy is known as CAR T cells, which is chimeric antigen receptor T cells. Now these are actually T lymphocyte, which is a type of WBC or white blood cell inside our body. So if a person has leukemia or lymphoma of a certain type, these cells are taken out from the body. It's genetically modified externally and then given back to the person to fight against the leukemia which is uncontrolled or the lymphoma which is not responding well to treatment. Chemotherapy generally is a non-specific way of treating. So they will kill cancer cells, but at the same time they can cause some harm to normal tissue. That white blood cell can come down, hair can fall, skin changes can happen, and sometimes diarrhea or ulcers can happen. But immunotherapy is a very directed way of treating the cancer cell and also modifying your own immunity.
All types
host
of
response.
cancer, Doctor?
Most of the type of cancers, not all cancers, but the spectrum is increasing every day. Previously we were treating only one or two type of cancers, but now the spectrum is increasing and covering most of the cancer types.
ಓಕೆ, ಈಗ ಕಾಲರ್ ಇದ್ದಾರೆ, ಮಾತನಾಡ್ಸೋಣ. ಬೆಂಗಳೂರಿನಿಂದ ಮಂಜುಳಾ ಕರೆ ಮಾಡಿದ್ದಾರೆ. ನಮಸ್ಕಾರ ಮಂಜುಳಾ ಅವರೇ. ಮಂಜುಳಾ ಅವರೇ, ದಯವಿಟ್ಟು ಟಿವಿ ವಾಲ್ಯೂಮ್ ಮ್ಯೂಟ್ ಮಾಡಿ ಪ್ರಶ್ನೆ ಕೇಳಿ.